My name is Ginny McCarthy, and I'm the Director of Health Sciences Ministry at Loyola. It's my privilege to welcome you here today. In addition to our tremendous speakers, we have two additional facilitators whom you will also see today. Lucia Garcia, Director of Student Affairs for Parkinson School of Health Sciences and Public Health, as well as Dr. Lena Hatchett, who's an Associate Professor in the Neiswanger Institute for Bioethics at Loyola. Dr. Hatchett will also pull double duty of presenting and facilitating our conversation on bold vision and our 150-day goals at the conclusion of our time together. This event is a signature event during the sesquicentennial celebration of Loyola University Chicago. An event such as this reminds us both of our mission and the impact of Loyola, which for 150 years has called students, faculty, staff, alumni, and partners to advocate for change, to use collaboration creatively, and to address injustice both in its immediate and systemic presentations. This is what it means to be a part of the Loyola community. And the timing of this conference is important. Community violence rates have increased dramatically during the COVID-19 pandemic. The struggles of the pandemic, not surprisingly, have trended along familiar lines, bringing increased burden to individuals, communities, and families who already bear a significant and heavy burden of life and of injustice. We see the demand for racial justice in and through our time in the community and in and through the work where we address the pandemic. We work for just and equitable access to resources, including access to healthcare. At the risk of further stating the obvious, this confluence of factors is the context of our conversation today, reminding us of the clear and urgent exhortation to move forward together, hopefully through renewed, deepened, and innovative collaborations that build upon all we hear today. It is the desire for and the willingness to work for change which brings us together in this group and moves us forward in shared action. Regarding schedule for today, our hope is that we will first hear from our esteemed keynote speaker, Cook County State's Attorney Kim Foxx. We're so grateful that you were able to join us today. We will then hear from a series of presenters from across Loyola University and Loyola Medicine. We'll learn about initiatives and programs which address community violence prevention from a variety of disciplines and through collaborative practice. Finally, we will conclude by naming a bold vision and a 150-day goal for the group gathered. This will guide our ongoing collaborations and will offer a time for a bit of conversation. I'd also like to offer a warm welcome to many of you who were with us last year, including some of our presenters. It's wonderful to have you with us here today and to see that 1 year later, we're still in conversation and still in collaboration. One quick note of housekeeping, as it always happens at the beginning of a conference. Due to the virtual nature of this gathering, I would like to highlight the Loyola Stands website, which will drop into the chat here. You can easily access the schedule for the day, full speaker bios. We'll use an abbreviated bio in the introduction for each speaker, but you can access more information about their ongoing work there. And then we'll post resources there after this conference. Each presenter has 10 to 15 minutes or a little less if you're a shared slot. Thanks, Lisa and Dr. Olson for that. But we will have other resources that folks will hope to access. So check back there periodically. We'll also update on our bold vision and our 150-day goal. As a note of disclosure, none of the planners for this educational activity have any relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. So that is our disclosure for today. Once again, thank you for joining us here today, and we look forward to these presentations. We'll move now into our keynote address. State's Attorney Kim Foxx is the first African-American woman to lead the Cook County State's Attorney's Office, the second largest prosecutor's office in the country. State's Attorney Foxx took office on December 1st, 2016, with a vision for transforming the Cook County State's Attorney's Office into a fairer, more forward-thinking agency focused on rebuilding the public trust, promoting transparency, and being proactive in making all communities safe. As Cook County State's Attorney, Ms. Foxx has undertaken substantial criminal justice reforms focused on public safety and equity. She has revamped the office's conviction integrity unit, has been a leader in bond reform, has taken the lead on prioritizing resources away from low-level offenses to focus on violent crime, played a vital role in passing legislation to legalize cannabis and provide the broadest and most equitable conviction relief possible. Providing this relief is not only a critical part of righting the wrongs of the failed war on drugs that disproportionately harmed communities of color, It is also a statement of our values and commitment to justice for all. Thank you, State's Attorney Foxx, for joining us here today. We will now move into our keynote address.
Thank you so much, Jenny, and thank you, Loyola community, for having me a part of your summit this year. I'm always profoundly grateful to be able to be among our future leaders and current leaders as we tackle the issues that are facing our communities, and particularly the issue of gun violence. And so to commend all of you for pulling this together, especially during these challenging times, and recognizing the need now more than ever to gather collaboratively to address the issues that we're facing. I think it is probably been stated in every Zoom meeting, summit, conference that you've attended in the last 6 months or last 11 months. These are times unlike any other that we've seen in our lifetimes. That as we look to tackle these issues related to violence, particularly gun violence and crime, doing it in an era that is truly unprecedented and that has highlighted a lot of the structural systemic issues that we've talked about in theory for years, playing out in practice in real time. The pandemic has highlighted where it is undeniable, even to those who seek to keep their heads in the sand, the institutional and structural racism that has permeated many of our institutions. In the criminal justice space, is the last institution that watches these structural failures along the way. And so this collaborative approach is incredibly important. As we talk about first responders, I often remind people that as a law enforcement agency, we're actually last responders. That when we meet people in the criminal justice system, it is often after a chalk outline has been drawn on the ground, after someone has been grieving, after we have seen the worst that can happen in a system of failures. That in this last year, when we have been grappling with the horrors of the coronavirus pandemic and the reckoning around race and justice in the criminal legal system in the wake of the death of George Floyd and Breonna Taylor, and the reconnection to our own storied history here in Cook County, and look at the disproportionality of those who are dying or not having access to vaccines or access to testing, or looking at the high increase in violent crime in those very neighborhoods where we saw in 2020 an increase in gun violence, an increase that you all are seeing every day around carjackings, an increase in the deterioration of the fabric that so many communities rely on. At the same time that we're dealing with the pandemic, at the same time where we're dealing with this increase in violence, again, we cannot lose sight of that there is an overlap in the communities that are hardest hit, and that the response to the violence that we are seeing requires us to take on, without apology and without hesitation, the systemic issues across the board. And again, it is why for me in the law enforcement space, it is always gratifying to see a collaboration of experts from across fields. Because I am often asked as the state's attorney, what are you going to do about violence? And that necessarily absolves the rest of our communities to do the hard work to deal with the things that we know drive violence in our neighborhoods. Things like education, in an educational system that is funded in a way that has made neighborhoods that most need solid quality access to opportunities in education be the most underfunded. Educational disparities that see communities, Black and Brown communities in particular, lag behind others, and still asking those same students with the lack of resources to compete at the same level. It's around access to healthcare. That if we do not talk about access to healthcare, and not just in the realm of the pandemic, but in maternal health issues, where we're seeing African American women dying at higher rates during childbirth, where we see the death rates and the disparities around those who live in some of our more affluent neighborhoods, and you travel a few miles and the death rate is significantly higher for the same issues, whether that is related to high blood pressure, health or heart disease. Again, not that these communities are somehow more readily susceptible to these issues, it's the access to healthcare. Economic development. We cannot talk about violence and crime and not talk about the total disinvestment in certain communities, particularly communities of color, over the course of last several decades. And at the same time, the neighborhoods, much like the neighborhood that I grew up in, um, fundamentally changing and crime rates significantly dropping. For those of you who don't know, I say it in every speech that I give. I grew up in one of the toughest public housing projects in the country. I grew up in Cabrini Green in the 70s and 80s. At the time that I grew up in Cabrini Green, it was an exemplification of some of the worst failures of public policy that we had seen. Failures around housing policy, failures around economic investment, failures around crime and violence. At the time, I lived at 624 West Division, which was a tower right on the corner of Division and Larrabee, where the concentration of poverty was literally stacked on top of one another, and where violence rates in the 70s and the 80s and the early 90s were significant. Homicides in the area in Chicago in 1989, 1990 were hovering around 1,000. And of those, we were seeing just in that concentrated area in the city, homicides by the dozens. And now that same area, which was devoid of access to groceries, where the education system fared very different than the ones a mile north, where I ended up moving to Lincoln Park, we now see that area has fundamentally transformed and the crime rates have dropped significantly. Well, what do you mean? Public housing and the failures that we saw as a result of that shifted, and the towers were torn down, much like across the rest of the city. We saw a shift in resources that were then being put into the area of Cabrini, such that grocery stores were moving in, small businesses were coming. We saw a shift in who was moving into the neighborhoods and the housing quality, the shifts in the schools. One of the finest schools in the city of Chicago that is now a premier institution was one of the most underfunded schools back when I was a child there. They're so flush with resources in the neighborhood that I once grew up in that there is an iFly. And I don't know if those of you on this call know what an iFly is. It's an indoor skydiving place for people who want the experience jumping out of airplanes, but not wanting to get into an airplane. They go into this building that's right off of Halsted and Division to simulate falling out of a plane. That's how flushed with resources they are. And the violent crime rate in that very neighborhood where we saw the disproportionality of violence in the 70s, 80s, and 90s has plummeted. This is not an issue related to the people who were there. It is an issue related to the conditions and the investment in those communities. This is my long-winded way of saying that dealing with violent crime is about dealing with the institutions and not making the assumptions about the morality of the people who live there. Because for far too often, if it was simply a matter of those people doing bad things, then we could absolve ourselves of the deep work that is required to deal with violence in our communities. The deep work of looking at our legislation and how we attack these issues and whether we are doing more harm than we are good. And so, as state's attorney, for me, it has been deeply personal to tackle these issues from the vantage point that I have in the criminal justice space, but also working collaboratively with institutions like Loyola and across sections within those institutions in healthcare, in education, in economics, to talk about how we can address these problems. First and foremost, my priority has been keeping our communities safe. And in doing that, doing an examination of the work that we've done to achieve those goals. One of the things that surprises people about the work at the state's attorney's office, we are the second largest prosecutor's office in the country. in a county that is dealing with the unrelenting toll of gun violence year after year, is that 40% of our resources in the state's attorney's office, 40% of the cases, I should say, that come into our office are drug cases. Drug cases. That when we look at the biggest percentage of work that we do, it has largely been around not issues related to violent crime, but around people who are struggling with issues like substance use disorder or mental health, conditions that can be dealt with outside of the criminal justice system, that should be dealt with outside of the criminal justice system, that we have as an institution and as a society allowed to be criminalized for so long that there's an over-reliance on incarceration to deal with these systemic issues that can be dealt with in the healthcare and the mental health space. But the criminal justice system has become the dumping ground for those disinvestments and those failures in our system. So for me, tackling issues like substance use disorder means partnering with organizations outside of the criminal justice system to say, if we stopped punishing people for being sick, what is the alternative to helping people get well? What is the role of our institutions outside of the criminal justice system to treat public health issues like a public health issue? What would it mean to stop relying on law enforcement to do that? And the same thing with mental health. For often we see the duality of people who are struggling with mental health, who also are dealing with substance use disorder, and the failed belief that having people prosecuted and incarcerated is going to deal with the underlying issues. If we don't deal with the root causes, there will always be this continual loop of people coming in and out of our justice systems and our communities not being safer. If we don't deal with the root causes, that person who is struggling with substance use disorder, who will do anything and everything to provide or get the resources to sustain that, means that our communities won't be safer. They won't be safer. And that if we're going to deal with the issues related to having people have faith and trust in the system to deal with violent crime, because that's what we in the justice system should be focused on, is dealing with the drivers of violent crime. If the very people who need to believe in the system the most trust it the least, because we focus all our attention on criminalizing behaviors or criminalizing communities and not taking seriously the history that we have seen in this county specifically around the relationship between law enforcement and community, and ask these same people to trust us, we're going to find ourselves where we've been in the last several months. So what does that mean? It means for me as a prosecutor that we have to align our positions around dealing with public health and public safety appropriately. It means focusing our attention on strategies around dealing with gun violence with our gun crime strategies unit, embedding our attorneys in the neighborhoods most impacted by violence, working collaboratively with law enforcement to deal with violent crime from the ground up, meaning we also have to instill trust with the communities that we serve. In addition, it means undoing the harms of a justice system that far too many people have lost faith in. That means pulling away from prosecution or pulling away from the failed effort on the war on drugs and working with institutions to deal with substance health and mental health in community. It means righting the wrongs of the past with our conviction integrity unit and overturning those convictions that we know were ill-gotten. And for those who lived in those communities that have been impacted by it, to see and trust that we see them, hear them, and acknowledge the mistakes that we've made. It also means being transparent and using data. It means working with researchers like Loyola to examine the work that we've done to say, in fact, we are doing harm or doing good. It means taking on issues like bond reform and criminal justice reform, because we know that it is a false choice that you can have criminal justice reform or public safety. I have to tell you unequivocally, you cannot have public safety if you do not tackle criminal justice reform. You cannot have one without the other. It's not even just that there's a false choice. You cannot have public safety unless you address criminal justice reform and these underlying drivers. And so my initiatives over the next term will be to do just that, to bring in more partners, to work collaboratively on the drivers of violence, to talk about and tackle the issues that are systemic, that are uncomfortable to talk about, that are uncomfortable to address, that sometimes feel insurmountable. But what I know by looking at all the faces and looking at the agenda for today's summit and recognizing that we're doing this across disciplines as part of one large community, that that is the only way that we're going to be able to address that. And so I am honored and humbled to be able to be in partnership and collaboration with all of you. I must give my personal shout out to Professor Olson, who's on here, who's been a tremendous resource to us as we explain in numerical, statistical data ways why bond reform, for example, is not making our communities less safe, but in fact, addressing some of these root cause issues related to poverty. That I'm grateful for that community that we have with Loyola, again, across sectors, to be able to come to the table to offer solution and resource so that it is not incumbent just on the last responder, that we can in fact have a violence prevention strategy that meets the needs of the communities that we serve, that rights the wrongs of the past and put us on a future that sees in every community where they are now the potential to meet their highest and best selves. So again, I congratulate you all here for convening in these difficult times, for recognizing that the time has always been now, but the urgency of now with all of these issues exposed and the real certified belief that all hands are on deck to see Loyola's leadership in this effort. And I thank you for allowing me to be a part of it. And beyond just today's remarks, but really moving into the future to incorporate all of your disciplines into a path forward for our county. So thank you.
Thank you, State's Attorney Foxx, for that very impactful keynote. We're thankful to have you here today and appreciate your words. We are now going to open it up for a few minutes for questions. So I welcome you to unmute and or include your question in the chat, and I will facilitate.
State's Attorney Foxx, thank you for your remarks and thank you for your partnership today and moving forward. I have a question for you. What would you, at the end of this day, we're going to talk about bold vision. If you were to state a bold vision, you could have anything, access to any resource to make one thing possible. What is the one thing you would focus on in the immediate future? And dream big. There's no resource limitation.
You know, it's not even so much a resource issue. I think some of our boldest envisioning is of things that we can stop doing, right? As opposed to like things that we can imagine doing. There's so many things that we can stop doing. Stop relying on the criminal justice, criminal legal system to deal with issues that we know that we can deal with in community. One of the things I think of, for example, there was a case that we just dismissed a couple of days ago where a mom trying to find housing for her and her 7 children were living in an abandoned apartment. And the police came and saw that she was living in an abandoned apartment and that they were using the bathtub as a toilet and there was backed up. It's awful conditions. And the mother was charged with child endangerment. That's not how our system should be used. And what happened was the community, recognizing that this mother was in need of resources, stepped in to be able to help provide for that. In the middle of a pandemic, in the middle of an economic downturn, particularly where we've seen women disproportionately impacted by job losses, that our immediate response when we saw a family in trouble was to engage the criminal justice system. And so I think when you talk about envisioning bold, it really is, let's start to do a check on what we do when we see crises, right? How can you shrink the footprint of the criminal justice system? How do you shrink the footprint? I think any discussion that I have around what the future should look like is an engagement in a system that is only there by necessity and not by convenience. And I know that there's been a lot of conversation around the phrase defund police and what does it mean? And the reimagining for me is about how do we use our resources to deal with the things that we know drive people into the system, and do that and stop doing all the other stuff that causes harm. Recognize the harm that some interventions cause, the long-term harm of that phone call, the long-term harm of that engagement, and ask yourself, can we do something different? And so I know that doesn't feel very bold. This system is so dysfunctional right now by all of the things that we have become accustomed to doing, that the boldness would be if we were okay with stopping. If we were okay with just saying, I'm not going to use this system to deal with this issue, and I'm going to hold people to account. There's so much accountability that we need to put on legislators, on community, to deal with and provide for the resources that we know prevent crime. I'm a responder to crime. We have to invest in crime prevention. And that means imagining resources outside of the criminal legal system to do that. And stop leaning on the criminal legal system for all of our societal failures.
We have a question in the chat that I'd like to bring up. What criminal justice success in another state gives you hope?
Criminal justice success always feels fleeting because you'll have success and then you'll have a time like now where violent crime is on the rise, not just here, but across the country. And there will be this instinct to go back and say, aha, it is because we stopped doing the thing. So some of the successes, for example, in California around drug cases, around lower level felony cases where they bump down to a misdemeanor. In Illinois, for example, drug cases are, take marijuana out of the equation, are class 4 felonies. And what we know is that someone who gets a felony conviction is far less likely to be able to get a job, to be able to get housing, to be able to get education support by way of scholarships, that the path that people who have felony convictions go on lead them to be in this continual loop. And so seeing other places say, hey, we should not attach felonies to people who have drug convictions or make those felonies are inspiring. At the same time, a couple years later, as we see crime rates tick up, there is then this whiplash that says that we've gone too far. And so it's this weird thing about this pendulum. You hear about the pendulum a lot in criminal justice, like, oh, we've gone too far to fix the thing that we know is horribly broken. We would just want to fix just a little at a time. And I think the boldness of this is that we can't just talk incremental, we have to talk about large swaths. So Oregon, for example, has just decriminalized drugs, not just marijuana, harder drugs that make people, their chests, palpitate. But the reality is in 2020, we saw more opioid deaths in Cook County than we have seen, I think ever. I think it was a record number of opioid deaths. Sorry, a kid is coming home and my alarm is on. I am safe, don't worry about it. Hold on one second. You gotta love Zoom. But the reality is that we have so many people who are addicted to opioids, who are dying from opioid overdoses, and our response has to be proportionate in recognizing that need. And so places like Oregon, who are saying we need to invest in drug treatment rather than incarceration, give me hope. Obviously, the New Jersey bail reform efforts from years ago that we've modeled a lot of the work here in Illinois, eliminating cash bail, is also something that I'm very inspired by and that we have used here in Illinois to fashion bail reform laws in the state level.
Thank you. And I'll take one more question. Michelle, you had your hand up and I'd like to let you ask that question. It's a good one.
Thank you so much. Good morning, State's Attorney Foxx and everyone. I am Director of Student and Family Services for Proviso Township High School District 209, and I firmly believe that investments made in education are fundamental and foundational to really solving the problem, because I believe it's definitely the root cause. And so I'm wondering, I know we have evidence-based funding in Illinois, however, we still are very, very well underfunded. I'm wondering, in your conversations with lawmakers about like adequately, and not just adequately, but like well-funding education have like come away with in terms of what the next steps are.
Yeah, I mean, I think we have to, and one of the things that I've tried to do with my platform is tie it all together, right? Again, as the last responder, I should be in the conversations around education and education funding when we see, for example, if we look at the data of the young people who are getting caught up in the criminal justice system and look at the fact that, you know, a significant number of the young people that I saw when I was an assistant state's attorney in delinquency had IEPs, had individualized education plans for those not in the education space, which basically means that they had special educational needs, so what we would call special ed. And that for many of them, their needs were not being met in their individual schools because of the resourcing issue. And so if I'm able to say to you, listen, you we've got these kids who have these needs where the funding mechanisms that we have right now don't provide for their needs to be met on an educational level. And what we then see that translated into, when their educational needs are being met, many of these kids leave school, they drop out. And you can, again, correlate seeing the number of kids who end up in the adult system who have dropped out of school or who had these IEPs and say, there's a line here, there's a through line here. And that your response to crime, I'm seeing it right now related to carjackings, and young people is like, oh, it's almost eerily reminiscent of the super predator language of 2 decades ago, that we were so easily lulled into, that it is the failures of these children and their parents and not the institutions, where if you've got a 13-year-old who's out there with a gun and we don't recognize that that child was in somebody's school, where there was an educator who may have seen that there's something happening in the home, that perhaps there are all of these things that we can tune into as educators to be able to identify the needs of that child, and only respond with higher penalties, we're failing. And so for me, it has been, in my conversations with legislators around criminal justice issues, pushing the issue of education. I talk about the fact I left Cabrini when I was in 3rd grade and went a mile north to Lincoln Park, went to LaSalle Language Academy. It may have well been in a completely different place. The educational resources that we had at LaSalle, because we were a neighborhood school in Lincoln Park, was vastly different than the kids that we left behind in Cabrini. And the outcomes were dramatically different. Now, this is anecdotal, but I can look at some of my peers who I grew up with who did not have the access to the same education that I had, whether it was the ability to learn a foreign language starting in 3rd grade all the way out, the ability to learn about classical music and the like. It was really access to that that I think was a huge difference maker for me, and not a failure on the kids in the neighborhoods that didn't have those resources. And that is why, we have to have those tough conversations, because it becomes about, oh, those kids, their parents aren't teaching them, their parents aren't giving them. And it's like, no, the funding mechanisms where we can see a flat out disparity in how resources are allocated to school districts and the outcomes that they have measured across others who have greater investments and their outcomes. That disparity, to me, is a civil rights issue. That is not a those kids can't learn. That is a failure of these institutions. And so I think for me, using my platform to be able to make the through line to criminal justice when people are scared gives me leeway. I want to say I'm optimistic that legislators get it. I think when we talk about equity, it necessarily means that there's going to be someone who feels that you're taking something from me to provide for others. But we have to start recognizing that, we are only as strong as our weakest school district. That we're only at the highest potential of the weakest place that we have. And I say that as the first Black woman state's attorney. If you'd have told my mother that it would have been me coming from 624 West Division, people would hardly believe it. And so I imagine the talent that we are leaving behind in school districts or neighborhoods across the city. The cure for COVID is probably in North Lawndale. But we're not investing. And until we can see that we are just as invested in those school districts and it's not mine, we're going to continue to have these disparities. And I think they will continue to play themselves out again throughout the systems and ultimately in the justice system.
Thank you so much, State's Attorney Foxx, for your words, for your vision, for all that you have done and all that you are going to do. We look forward to seeing how everything continues to play out and to be partners with you in that to the extent that we are able and able to collaborate with you. So thank you for sharing your time with us. We are going to take about a 5-minute break here. We'll come back at 9:45 to carry forward.
Thank you.
Again,
Have a great
thank you,
conference, everyone.
Thanks so much. We'll see you back in about 5 minutes, 7 minutes.
Hi, welcome back, everyone. I'm Lena Hatchett, Associate Professor at the Nieswanger Institute right here at Loyola. I'll give folks a moment to come back from break. I see some phenomenal colleagues in education, public health, nursing, old friends, new friends. Welcome, everyone. All right. I wanted the opportunity to talk about my own bio for a particular reason. I didn't want to be introduced because our bios talk about what we've done and what we've accomplished. And if you take a look at mine, it looks pretty good. Working with Robert Wood Johnson, funded by Trinity Health System, got a book chapter. And it's not that those things are unimportant. Those are truly my accomplishments that I'm proud of. But what the bio doesn't tell you about me, Lena Hatchett, is how I created each and every one of those accomplishments. And the key word in my bio is co-founder of Proviso Partners for Health. And as an academic at Loyola, there's a lot of expertise, skills, and experience I bring to my work on racial and economic equity. But it is co-founding this coalition with a community resident, her name is Loretta Brown, that has made transformation in this community. We had the same values of what we could do in the Maywood and the Proviso community that is so important. She, as I, is a woman with lived experience of inequity. And it is our ability to understand the needs around race and class and oppression that has helped create the successes that I'm going to talk about. And Loretta couldn't be here this morning with me because as a great grandmother, she is raising her 8-year-old great grandson. And she's in her late 70s. She has helped to build this community and she's helped to build her family. And we need to understand those stories of resilience and transformation if we're going to actually transform the systems that Kim Foxx has talked about. So I'm going to give you a few highlights of our work around collaboration. Proviso Partners for Health started as a seed in a project called Cook County Green Corps. And we worked with youth who were justice involved from Maywood. Some were in and out of college. Some were recent graduates from high school. We didn't look at what those youth lost, what they lacked, or where they were deficient. We started to ask them about their hopes, their dreams, and their visions for their future. Not what they didn't have, but what they hoped to achieve going forward. We didn't hold it against them. We didn't actually ask who did what, when, where, or why. We didn't care because it was about their future. And in that project, particularly my stance on it, we were growing food. I didn't know how to grow food. We were building an urban farm. I didn't know how to build an urban farm. I didn't let it get in our way of what we were going to achieve because I relied on collaboration. I could relate to youth, and that's what I brought to the project. And I could partner with our public health system, our other allies within the community who did have the skills and the resources and the ability to achieve our big goal. The success of Cook County Green Corps wasn't because of my leadership. It was about my ability to collaborate and listen and learn how to fulfill this goal. And everything I'm going to say today is about our ability as academics, as students, as Loyola, to actually listen to people with lived experience of inequity to share power. And I in all honesty, right, I didn't start out, I figured I knew what to do and I had this degree and I had this experience and I was going to create the solution and the bold goal, and ask community to engage in it. And I learned very quickly the hard way that I was actually harming community, harming our youth, rather than helping them fulfill their dreams. So Cook County Green Corps was about listening to the experience. And we were growing food and we were interested in food access. But our 18 to 24-year-olds explained to me very clearly, very loudly, and very angrily, it's not about getting access to food. If I could have a job and an income and an opportunity, I would have my own money to do with it what I wanted, including buying food. And so how many of us are investing in small scale problems and not getting at the root cause, right? Of poverty, disinvestment, as Ms. Foxx has told us, historic disinvestment, generational poverty, and taking time, resources, grant funding, and effort to just put a Band-Aid on the problem and not get to the root cause creates the harm within our systems and not the opportunity that our young people need. And we learned the hard way, Loretta and I, but we quickly built on the information that our young people is explaining to us by listening, by sharing power, and by allowing people with lived experience of inequity to lead. Right? So we didn't let not knowing stop us. We collaborated. And the key thing that brought us all together is what we're going to do today, is having a bold vision for where we're going. I'm going to ask you a little later to not think about what resources you don't have, what expertise you don't have, what time and lack thereof you don't have to achieve something, the barriers in your way, and the people out there that are trying to stop you. I want to ask you the hardest question. What would you do if you had all of the resources, all of the staff, all of the time, all of the expertise? What would you actually do? And in Proviso Partners for Health, we were able to bring the community together and ask that question of what is our bold vision of what we want our community to look like? Because if we don't have a bold vision of where we're going, guess what? We're not going to get there. And while there are challenges, while there are lack of know-how, expertise, and resources, don't let that stop us from visioning about where we want to go. And my little time here is about bold, dreaming big with a bold vision, and taking actions in small steps. As academics, sometimes we spend a lot of time planning and preparing, controlling and owning and utilizing our power, and a very little time on having a big, bold vision for where we want to get to. And from our community here in Maywood, we learned that the bold vision is going to bring your collaborators together. The bold vision is going to strengthen your collaboration and your work. And our actions start small and build over time. So from Cook County Green Corps, learning from those youth of 18 to 24, that was in 2010, they told us a blueprint of what they wanted for their futures. And Loretta and I started to think about, oh, what could we do to rebuild the economic system in our community? And who would we need to collaborate with? And if we're talking about food and health, we got to talk about economics, and we got to do something about the economics in the community and not just think our job is to sit in a garden and grow food. We have to look at why this community doesn't have food in the first place, and how our youth who live here can be the drivers of transformation and not the recipients of handouts and distributions and charity, right? We got to look at the Black, brown, white racism and conflict in our community that stops us from collaborating, and see if we can tear that down to get to our bold vision. You know, Loretta is fearless, and I held on to her coattails and dreamed big too. And we didn't let any of these barriers, crime, education, poverty, systemic racism, we don't let any of those things get in our way, because we got nothing left to lose. Our youth are relying on us, and we have nothing left to lose. So we dream big, and we take actions in small sets, and we collaborate with our partners from public health, from the food industry to social enterprises, national partners, 8-year-olds. There aren't any limits to our ability to collaborate and to create the vision that we have. So today, in our time, I'm going to ask us to come to the table to dream big. What could we do as a collaborative, as an institution of Loyola, that we can't do by ourselves, that we could do together? We're not going to talk about what we don't have and who's not going to let us and if only. I wanted to take an opportunity to dream big. What would you do if you had all of the resources and you were not using the excuses? And then we're going to start to act small by looking at what would we achieve in 150 days to set us on the pathway. And it's a different kind of mindset, and I've learned it from the community, and we're going to try it here as an institution. So no excuses allowed. Just allow this time to dream. I'm going to give you a minute to think about that challenge that I put forth. I'm going to introduce you to Lisa Jacobs and Dave Olson. Some of you may know them very well, and it's a privilege to share their work and expertise and their long history. Lisa Jacobs manages the Loyola University Center for Criminal Justice Research, Policy, and Practice. And they are working hard to advance fair, humane, and effective criminal and juvenile justice policies and practice. Now, prior to the center's launch, Lisa served as program manager for the Illinois Models for Change initiative. And there she was promoting effective juvenile justice policy practice and programming in diverse jurisdictions across the state and in the nation. We're so thankful to have Lisa at Loyola, and she was the director of the judicial education for Illinois Supreme Court with the administrative office of the Illinois courts. So much experience, know-how, and practice right in our table, right here at Loyola. She currently provides subject matter expertise and technical assistance to jurisdictions working to improve the outcomes of youth dually involved in the child welfare and the juvenile justice systems. She's a consultant with RFK, National Resource Center for Juvenile Justice. There is a link to Lisa's information and her expertise. Someone can put that in the chat for us. And she'll be sharing her time with Dr. David Olson here today. And he's a professor in criminal justice and criminology department at Loyola University of Chicago. And he's a co-director of Loyola's Interdisciplinary Center for Criminal Justice, Research, Policy, and Practice. For nearly 20 years, Dr. Olson has worked at the Illinois Criminal Justice Information Authority, where he directs the Illinois statewide drug and violent crime control strategy impact evaluation program. I'm going to turn the floor over to Lisa and David, and I'd like us all, as we enter in these mini introductions to our work, to think about what we can do as a collaborative Loyola. What bold vision could we create? And the small steps of action that we can build towards it as you listen to each of our stories today. Thank you. Take it away, Lisa.
Thank you. And Dr. Olson, the floor is yours.
Okay, Lisa and I are gonna split up our 15 minutes. So my stopwatch has started. Thank you very much, everybody, for allowing us to participate. And I want to extend a special thanks to Jenny for not only organizing this event with her colleagues, but also welcoming us from the social sciences and the Lakeside campus to her and her colleagues. I also wanted to thank Lucia, because she's really the one that put our center in connection with the health sciences campus. Lucia saw a COVID and crime dashboard that my colleague Don Steeman created, and reached out to us, and since then we've been regularly participating in the meetings at the health science campus. And so we just wanted to take a brief moment to provide you with a little bit of understanding of the center, kind of its origins, its goals, its purpose, and then some of the projects that we're working on, just to give you a flavor for some of the opportunities that there might be for some increased collaboration. So the Center for Criminal Justice Research, Policy, and Practice, which is a long name and tongue ties a lot of people, is a unique collaboration between Loyola's College of Arts and Sciences and the School of Law. The center is co-directed by myself and my colleague, Diane Garrity, who's a faculty member at the law school. As was mentioned, Lisa's the manager. My colleague, Don Steeman, the chair of the Criminal Justice Department, is also a colleague in the center, and Amanda Ward is a postdoc that's been working in the center. I didn't list all of the students working in the center because I didn't want to fill up 2 or 3 slides, but since our inception, we've had probably close to 40 to 50 undergraduate and graduate students from a variety of disciplines work with us on different projects. The center was actually envisioned as part of Loyola's Plan 2020, the strategic plan that was launched in 2015. And we were fortunate enough to receive some seed funding from the MacArthur Foundation to start our work. What we try to do is provide students with experiential learning opportunities where they get the opportunity to collaborate with us, performing research, what we describe as applied research, with the ultimate goal of advancing the effectiveness of criminal justice policy and practice. We get involved a lot in working with state and local criminal justice agencies and stakeholders around strategic planning efforts, conducting research to evaluate the effectiveness or the impact of policy. And we also try to train practitioners and better educate them on some of the issues that we're finding and that they need to recognize. We've been fairly successful in attracting external funding. So since the launch of the center in 2015, we've gotten a little bit over $4 million in external funding, not only from foundations, but from a variety of governmental agencies. So to give you a little bit of a sense of what we do in the center and how we try to bring together really the tenets of what a Loyola faculty member is expected to do, through the center, we provide teaching, research, and service opportunities. I want to just touch on a couple of these to give you a sense of some of the things that we do. Obviously, we do a lot of research. This is either faculties and students working on research projects that are related to topics of interest to the students. But we also receive external funding to carry out specific research projects where, again, we involve faculty from a variety of disciplines. We collaborate with partners at other universities, and we also use that to support students that are working with us on these projects. We also provide a lot of service to the field. Collectively, we serve on a large number of advisory boards and commissions at both the adult and juvenile justice system level. We also work a lot with organizations that are serving justice-involved populations. And then lastly, with teaching, what we do in terms of teaching is the traditional teaching that a lot of academics would envision. We have students in classes that are engaged in research activities. But we also teach through speaking to other audiences. And so kind of an invitation for anybody at the health sciences campus. If you're ever interested in having one of us come out and speak to you or your colleagues or your students to help better educate them about the justice system and how it functions and some of the issues that it faces, we're happy to do that. We also speak and present information to a lot of external stakeholders. We see education not just being confined to the university, but we try to educate elected officials. We try to educate legislators and policymakers, because oftentimes they don't have a background in criminal justice. They may not have an understanding of criminal justice research or the science behind it, and we try to educate them as well, along with various advocacy organizations that we try to educate and provide better understanding to. Just to give you a sample of some of the projects that we're doing, and I kind of picked a few that I think are illustrative of the breadth of our work. We're currently working on a project looking at how the justice system responds to gun crime in Illinois. And because of so much of that activity occurring in Cook County, where State's Attorney Foxx is the state's attorney, we focus on that as well. One of the things we found in that research is that if being punitive with people who illegally possess guns reduced crime, Chicago would be the safest place in the state of Illinois. What we have found is that despite the rhetoric, sentencing practices in Cook County have historically been extremely punitive. Things have changed somewhat under Kim Foxx. She is trying to use diversion more to therapeutic interventions to address individuals who are charged with illegally possessing a gun. We're also collaborating with the city of Chicago. For those of you who may not be aware, they launched a comprehensive plan to reduce violence in Chicago. We're collaborating with the mayor's office to help them in the form of research to evaluate the effectiveness and impact of some of their efforts. We're developing a criminal justice data dashboard with stakeholders in Cook County so that practitioners but citizens alike can access information to better understand what's going on in the justice system that their tax dollars support and that the elected officials that they select are operating. We're also doing some work on improving prosecution performance. My colleague Don Steeman is leading a project that includes not only Cook County, but large jurisdictions across the country in developing performance measures and indicators for prosecutors' offices. And then lastly, we're also doing a lot of work with state and local practitioners and policymakers around reform efforts. We're working with the what's called the R3 board, the Renew, Restore, and Reinvest, which is the effort by the state of Illinois to take tax dollars generated from marijuana sales and focus those resources back into communities with the greatest need. As was mentioned by State's Attorney Foxx, we've done a lot of research around bond court reform efforts, both in Cook County and the state as a whole. And we've also done a lot of work to improve and enhance reentry policies and practices for those individuals who are coming out of institutional corrections. The last example of what we're working on, and I'm going to turn it over to Lisa to talk about, is we've been increasing our focus and understanding of what's referred to as emerging adults, and Lisa will explain a little bit more about what's meant by emerging adults, but how the justice system responds to these young offenders who are legally adults, but cognitively and developmentally maybe more like juveniles. So I'll stop there and I'll turn it over to Lisa.
Thank you. And good morning, everybody. It is wonderful to have the opportunity to be with you this morning to learn about the work you all are doing and the work that Loyola is really leading in Chicago, in Cook County, in Illinois, and beyond. And I'm also really pleased to be able to spend just a few minutes sharing some of the work that Dr. Olson just referenced, our work around emerging adults who are in contact with the justice system. And because we have such a short amount of time, I sort of feel like this is a speed date, if you will. So I'm going to put some things out there that maybe will pique your interest. And as Dr. Olson mentioned, one of the things that I think has been really important in our work as a center is dialogue and talking with people doing this kind of work or work that's related, but we may not even realize is related until we start talking with one another and learning from our shared work and realize that we can have a bigger impact if we're working together, sharing ideas and collaborating. So hopefully what I'm about to share with you plant some seeds for that kind of collaboration. If we had all day together, we would dive really deeply into the research about emerging adults in contact with the justice system. We'd look at the developmental research around the ways in which young adults are really a different group of people than either younger adolescents or fully mature adults. We'd look at the neuroscience and the brain scans, and we'd see what I find as a former biology student in my undergrad days, really compelling evidence that our brains are different when we are between the ages of 18 and let's say 25 than they will be when we're 50. We would look at the data, and Dr. Olson and Dr. Steeman and Dr. Ward have done really groundbreaking work to pull out data around emerging adults from our criminal justice system data sets and shown. So again, data that I think is incredibly compelling about the high prevalence of emerging adults in our criminal justice systems. Put plainly, there are a lot of emerging adults who get arrested, who are admitted to jail, who are in our court system. There are a lot of them. They comprise big proportions of our caseloads at every step of the way in our criminal justice systems. And then we've got much more limited data, but again, still compelling data that I think shows we don't get the kind of outcomes with emerging adults that any of us on this program today would want in terms of future offending, in terms of access to treatment resources, and the kind of things that we know really support well-being of communities and people in communities. So if we had all day together, we would focus on all of that research and data and hopefully come away convinced that we have to focus on emerging adults if we want the kind of outcomes that State's Attorney Kim Foxx talked about from our institutions. And I think Dr. Hatchett referenced young adults in the work that she does and what we're learning from them. So if we're all convinced that emerging adults need to be a focus of our work when we're focusing on criminal justice research, policy, and practice, I want to share a little bit about what we're seeing happen across the country and here in Illinois. The first is good news. I think when we started this focus on emerging adults, which was in some ways an outgrowth of both our juvenile justice work and our criminal justice work at Loyola, and we really started to focus on the 18 to 25-year-olds, you'd get some strange looks if you suggested that emerging adults were not the same as fully mature adults. Not everywhere, certainly, probably not among the kind of folks on this program. But if you were talking to the average legislator, for example, you might get the eyebrow raised, and we did. And we even would get reactions like, oh, come on. When you're 18, you know right from wrong. You're a fully fledged adult. You can, serve in the military and go fight and die for your country. You're an adult, and we need to just treat you as an adult in the criminal justice system. I think today we're much less likely to get that kind of pushback on the idea that emerging adults are different in important ways. And that it's certainly not a universal acceptance, and it's absolutely not a universal, there is not universal reflection of what the research and the science and the data tell us in our policy or practice. But there's momentum. And we can see that momentum reflected in a lot of different ways across the country and in Illinois. We can see what I call systemic change. Dr. Olson referenced a little bit about the statutory changes that we're seeing in Illinois. Young adulthood is being recognized more frequently in Illinois law. One example is in the new criminal justice reform bill that's awaiting the governor's consideration and signature. There's a provision that would change how we sentence young adults, particularly whether and how we would designate them as habitual offenders. We see embedded in Illinois law a first-time weapons offender program and sentencing provision in Illinois law that recognizes these differences of emerging adults. And one of the more, I was going to say radical, but that implies judgment. One of the more bold, I think, and I'll leave it up to you all to kind of to think about the impact that it would have. One of the more bold ways that states are tackling the realities around emerging adults is trying to raise the age of juvenile court jurisdiction so that youth up to, let's say, 21 would be subject to the juvenile courts when they are arrested versus adult courts. Vermont is in the middle of that. Massachusetts is on the cusp of that. And there is legislation pending again in Illinois to raise the age. We also see things like young adult court models, and we could spend a lot of time talking about that. In fact, Chief Judge Tim Evans of the Circuit Court of Cook County just recently published with the Illinois Supreme Court a column calling for a third approach, a separate approach for young adults when they come into our justice systems. We see more diversion efforts focused on emerging adults. I think in acknowledgement of what both Kim Foxx and Dr. Hatchett referenced, which is the harm that can occur when young adults are pulled into our justice systems. And so these diversion efforts really focus on either keeping them out as much as possible or preventing a conviction. Cook County is starting a very innovative diversion program that we have helped them both with data analysis to help target and then some technical assistance to help design. They're starting a diversion program focused on young adults who are charged with possession of drugs with intent to distribute. So these are the young adults who are allegedly engaged in drug sales in communities in Cook County, distinguished from those with substance abuse treatment needs who need to be on a different path toward treatment. This program is really focusing on young adults who are selling drugs to survive and to earn money. And so, as you can imagine, if that's the target, to keep these young adults from getting a serious felony conviction for selling drugs, the interventions really need to be focused on alternatives for those young adults to earn money, meaningful jobs, meaningful connections with their communities, and a path away from selling drugs to earn money and to survive. Because our time is so limited, I'll really fly through what Loyola is doing. As Dr. Olson already alluded to, I think sometimes one of the most important things that Loyola is doing is creating a space or creating a venue for conversations and relationships and knowledge sharing and knowledge transfer, particularly around emerging adults. And we've done a lot of that over the last 5 years. And as I hinted, Loyola was really on the forefront in Illinois and beyond in this focus on emerging adults. And so bringing people together and sharing, what the lens that we're looking through is criminal justice involvement, but those in a healthcare realm, for example, are seeing some of the same things through this different kind of lens. So bringing people together and sharing what we know, what we value in terms of outcomes with young adults, and planting seeds for the kind of work that I talked about in terms of systemic change, diversion, community-focused partnerships. We've been doing a lot of research and data analysis. As I said, Dave and Don and Amanda are really the pioneers of making emerging adult data available in Illinois. Without them, we would know a lot less, and we would be a lot less effective in our work to improve outcomes with emerging adults. We've convened an Illinois Emerging Adults Network to formally focus on this issue of policy and practice when emerging adults are arrested and introduced into the criminal justice system. We paused that work during the pandemic because so many of our members of that network are on the front lines of figuring out how a criminal justice system responds to the pandemic, but we're about to start up again. And I think one of the things the Emerging Adults Network is going to need to focus on is this, this partnership between community-based corrections, community corrections, probation, for example, and how they work with community partners to keep young adults out of prison, frankly, and out of that trajectory into prison. We're also working at the national level. We've got a project underway with the National League of Cities where we're bringing stakeholders from across the country together to focus on improving outcomes. And that's mayors and police chiefs, judges, state legislators, really a wide swath of people from across the country. We're providing technical assistance and subject matter expertise as we try to spread these innovations across the country. And we're also conducting an updated, what we call a national scan. So if you're particularly interested in this topic, we're working with students, law students in this case, at Loyola, to create a national tool that can be used. If you're convinced that we need to focus on emerging adults differently, here are some ways that places across the country are doing it, and here are some lessons that we're learning. In the last probably 2 minutes I have with you, I just want to touch on what those lessons really are. And we've already heard so much about them. So whether we're talking about a change in statute, whether we're talking about a diversion program, whether we're talking about a community-based partnership with young adults who are justice system involved, we are hearing clear themes of what works and what young adults need. And the first clear theme we're hearing is that emerging adults really are different. The brain scans are not lying to us. Young adults are different from younger teenagers, and we need to acknowledge that and work with them differently. And they're very different from fully mature adults in their 30s and 40s and 50s. So the practitioners across the country and across Illinois are saying, yes, emerging adults really are different, and we need to acknowledge that and respond to that if we want our work to have an impact. We hear a lot about relentless engagement. And I think Kim Foxx alluded to that, this idea that, and certainly Dr. Hatchett, your remarks alluded to that. We can't just, offer a referral to a program and think that young adults are going to take us up on what we want to offer them. This idea of relentless, repeated engagement, especially with young adults who've experienced some pretty profound traumas. If we want to make linkages with them that keep them out of penetration of the justice system, people have to be willing to engage over and over and to acknowledge that we're going to have slip-ups along the way. We've heard from young adults that partnership and supports, particularly in non-judgmental ways. I was listening on a panel just a couple of weeks ago, young adults across the country, and they said it in different ways, but they all said the same thing. They wanted adults to help them figure out what was happening and how to navigate these systems that we pull them into. They don't know language like terms of probation or the sentencing language that we use or the acronyms that we use or the terms of their probation, for example, and what it means to them. They want an adult partner who's on their side, invested in their success, helping them navigate these things. They may not call it that, but they're also very interested in restorative approaches to build, rebuild, strengthen relationships within their families and their communities. And they are dealing with pretty significant traumas when we're looking at young adults who get to the point where they're being arrested and facing jail or incarceration. There's often traumatic experiences and a history of trauma that we have to acknowledge and we have to address. And I think that across the country and in Illinois, we're building our capacity to work with young adults who've experienced this kind of trauma. And then last but not least, the theme that we hear is, we may think that we are justice system practitioners. We are probation officers, we're judges, we're police officers, we're researchers. But if we're not attending to the basic needs of young adults, shelter and food and clothing, we're not going to get very far in our other interventions or our other strategies that we're employing. So many young adults who are enmeshed in the justice system don't have housing, don't have food, don't have these basic needs met. And if we're not attentive to that first and foremost, we're not going to get very far with the other things we're doing. So in the home stretch of our speed dating here, looking ahead, I think the theme is that we have momentum and partnerships and people really interested in delving into the research and the data and applying what we know from both the research, the data, and then the human beings who work with young adults, really applying that knowledge to what our laws say, to what our policies say, and to what we're investing in. And I think looking into 2021, there's a solid recognition that if we want better outcomes, if we want safer communities, if we want young adults to be on a path toward well-being, We've really got to focus on the unique challenges and the unique opportunities that young adults present us. And last but not least, I'll say that the data makes it very, very clear that if we want in any way to tackle the racial inequities that we have in our justice systems, to start to build racial equity and racial justice, again, it's going to take us to a focus on emerging adults. So thanks for sharing the time together this morning. And I hope that we can build collaboration across the university and with the communities that you all are serving in your work as well. That was very fast, but thank you.
Thank you, Lisa and Dave. That was wonderful. We're so glad you're here, and we are excited to work with you in the future as well. I'd like to present our next presenter for today. Dr. Donaldson, Dr. Kristen Donaldson is an assistant professor of emergency medicine at Stritch School of Medicine and practices clinically as a full-time emergency physician at Loyola's Level 1 Trauma Center in Maywood. As both faculty for medical students and residents, she has been recognized as a top educator, most recently receiving the Emergency Medicine Residency's Outstanding Teaching Faculty Award for 2020. Prior to medicine, she studied public health at the University of Illinois at Chicago and worked for many years as a business strategy consultant in health and life sciences industry. Her early public health work addressed education on drugs and alcohol, interpersonal violence, and sexual health. She then began to focus on youth violence and more specifically, gun violence and the prevention of trauma recidivism. Welcome, Dr. Donaldson.
Unmute. Thank you. Thank you for having me. I feel like the oddball out because I made slides. I don't know how to do this without slides. No, I'm just kidding. So I'm going to share my screen and I'm going to cover some hopefully quickly because I think we have fallen behind, but I will try to make this happen. Can you see my screen? Because I can't see you guys. All right, perfect. So I was asked to kind of cover some trends in gun violence, and I like to start this with one of my favorite quotes from Martin Luther King: "Darkness cannot drive out darkness, only light can do that. Hate cannot drive out hate, only love can do that." The darkness he speaks of in this quote is violence. And as we all know, I'm speaking to my peers, so violence is all around us. And the answer isn't more violence, it's that we need to teach our children and our communities that there's a better way forward. And that because guns destroy the lives of more than just the person that is shot. Over the years, I was inspired to do a lot of this work because many years ago, I spoke to a young boy, he was about 6 at the time, who asked me, and we were working with, I think it was I was working with a little baseball team outside of Chicago. And he had asked me how old I was. And when I told him I was 27, he said, "That's so old. I'll never be that old." And what was sad is that the underlying statement here was that at 6, this boy had already seen so much violence and death in his own community that he truly believed he would not reach adulthood. His statement has stuck with me all these years, and now as a mother of 3 kids close in age to this little boy, it hits home even more how much guns do hurt. They hurt our families, our communities, and they even threaten our future. That little boy needed to know that there is a future, and there can be one without the violence we see every day. As an emergency room physician, I see the individuals hurt by gun violence more apparently day in and day out. And there's stories that stick in my mind to this day. The pregnant mother that was shot while trick-or-treating with her 3-year-old, the promising college senior that he spoke with me. I was the last person he spoke with, and he had fear in his eyes, and I tried to comfort him. And then dealing with an entire family, including multiple children that were murdered and survived only by a mother who just happened to be out on a date that night when the shooting occurred. And there's more than one of these, but the sobbing mother that laid at my feet crying when I told her that I couldn't do anything more to help her son who had been shot that night. We do heroic efforts to address gun violence. And, we see this across the city and across the nation in our trauma base. And these stories make this problem real. And it's up to us as a group, and that's why we gathered here today, to find real solutions. When it comes down to the numbers, gun violence is the leading cause of premature death in the US. It kills about 38,000, which is a year, which is equivalent to about how many die in car accidents. And it injures up to 85,000 people each year. In Chicago alone, in 2019, we had about 2,500 shootings with almost 500 homicides. In 2020, that number jumped to over 4,000 people shot, with 769 killed. Anecdotally, I felt this last year, we were seeing a lot more violence in our ER. And it's alarming given the other struggles that everybody is facing in these times with the pandemic. Now I've seen the numbers, and they speak volumes, because we have seen a significant amount more gunshot wounds and injuries in our ED and in our Maywood community. We have a trauma registry that, and demographically, over the last 7 years, we've been tracking traumas from gun victims, and we've had about 1,200 patients seen at Loyola. The average age is around 27, and 90% of them are young men. About 17% are Latinx, and 64% are Black non-Latinx men and women. We have about 55% of those injuries are assault-based. Another 17% is accidental, and then there's about 4% that is suicide or self-harm attempts. And so these numbers, when you think about it, 79% we've talked about those emerging adults, 79% of injuries they're less than 35 years old. This is also 72% of our deaths are less than 35 years old. So these are young men and women in our community, and mostly men, that we are seeing hurt by this epidemic. This is a view of those 7 years by month. Looking back, we can see that 2020, it has the tallest bar. So it is by far one of the worst years we've seen in Maywood in a while. In 2019, we had about 149 injuries seen in the ED or trauma bays at Loyola, while in 2020, this jumped up to 247 injuries, confirming that suspicion that many of us in the emergency department suspected, that we were watching way too many young people roll through our doors with gunshot wounds this last year. This is just the same information, but in a different view, if you like to see those curves and showing the trends. That dark blue curve on top is the 2020 year, and the yellow, which was 2017, which was our next worst year, with about 222 injuries. In 2020, about 10% of the injuries actually occurred in Maywood. So as an area or regional trauma center, we do see patients from outside of the Maywood catchment zone. But these are specific in our registry. These are 10% occurred in Maywood, and about 15% of the injuries were actually Maywood residents. So as you can see, and we found over the 7 years cumulatively, about 84% of our patients survive, leaving a large potential burden of injury and long-term effects that we as a community have to deal with and address. This is just a quick look at just 2020. When you look at it, I also, in light of COVID, I kind of threw in the shelter-in-place order there. You can see that broken out by a month, you can see that we tend to have trends where we see more injuries in the summer and warmer months, but these trends, these are real people. These are our neighbors and families that are hurting because of gun violence. Mm-hmm. On top of that, we have been faced with this pandemic in 2020 that has affected so many aspects of our lives. And now this is hot off the presses from JAMA earlier this week or last week. showing that we're seeing trends showing rises in mental health visits, overdoses, particularly the opioid overdoses, as Kim Foxx had spoken about, that this is one of our worst years. I think the Cook County Medical Examiner has, we've had like almost 1,600 opioid deaths this year just in Cook County. And other forms of violence such as interpersonal violence, suicide attempts, and child abuse and neglect. These all seem to have taken a big uptick in 2020. Now, this is just me playing, so this is not truly scientific map, but when you lay those curves over, I kind of threw a combined view of the Maywood firearm injury data and this JAMA mental health and overdose data for 2020, where we saw an increase of basically all forms of trauma, particularly from March through September, with a dip in July. And I don't know, was that related to some of the loosened social restrictions we saw in the midsummer, which then returned later in the fall? But in the end, past research on these public health crises, such as COVID, show that the impacts far outlast this emergency crisis period. And even in that crisis period, we are looking at such an increased burden that it just underscores our need to strengthen our prevention efforts at the individual, community, and societal levels. This is just a glimpse of the burden of trauma in all forms that we are seeing in the community that we serve here at Loyola. And back to that darkness. So that darkness, that burden that I talked about, the costs associated with violence, they're financial, they're social, and psychological costs. And that's what creates this need for the public health approach that we are building today as a coalition for the prevention of violence. There are studies out there that say the cost of firearm injuries estimated to be up in the range of $230 billion a year. This includes healthcare, law enforcement, insurance costs, employment loss. Imagine the good we could do. Imagine how bold we could be if we could prevent these costs and actually use them for other things, right, in our communities. Yes, the darkness persists, but events like recent violent deaths and mass shootings have started to push the narrative and bring to light what we need to do to stop the hate and violence that is so prevalent in our society today. And its violence in its many forms is preventable. And it is the public health crisis that we need to continue to address. And that's the work we're doing now. It's being described by so many collaborators today. This kind of work gives me hope that we are providing a greater focus on prevention and reducing violence in our communities by addressing the underlying factors. Loyola Stands is a multidisciplinary committee, which many people in this group are part of. I see many faces that I recognize, that formed in 2017 as a collaboration to support patients and family members by gun violence, and grew from there. We're working with the Loyola community, Maywood, and other surrounding communities to make strides in addressing those underlying issues that have an association with violence, such as lack of jobs, concentrated poverty, drugs and alcohol abuse, lack of education, and absence of trauma recovery resources. Some of the programs that we've got in the works or have been working with is there's an AmeriCorps partnership for certified nurses assistance program to provide training and local jobs to our community members. Stop the Bleed programs and other educational activities such as today's conference, including community grand rounds on topics identified by the community, are some of the educational programs we have out there. Our chaplain ministry has done great things with Mother's Dawn gatherings to support mothers and other family members of victims of gun violence. And then the data analysis and academic presentations on the scope of gun violence that we're facing in the Loyola catchment area, and then taking that a step further and developing partnerships with the community and police to address this gun violence. We've also worked on a regional network collaboration to explore the feasibility of a community-based trauma recovery center model, and hope to strengthen that network in the coming months and years. and then perhaps one day be able to develop a center to address trauma recovery in our own community. And then as we move forward in 2021, Loyola Stands will work with community partner organizations to explore the prospects of social enterprise in the village of Maywood via our R3 planning grant to address that disinvestment that Kim Foxx spoke about earlier. And all of this work and the work that everyone here has been doing is spreading that light and spreading the love that MLK spoke of so long ago, to save lives, to build healthier communities, and to stop the violence. Let me stop my share.
Thank you, Dr. Donaldson. As the end of each presentation, I think, gosh, there's so much more to say, and hopefully the coming weeks and months will be the time where we continue to discuss and to use these partnerships as we move forward. So now we will transition into a presentation by Dr. Kelly Henry. Dr. Henry is an assistant professor at Loyola Medical Center. She's board certified in internal medicine and pediatrics, who also specializes in palliative care. She has an interest in gun violence prevention and is co-lead for the Be Smart campaign in Elmhurst, Illinois. Be Smart is an organization that is dedicated to improving awareness on secure gun storage practices, which can save children's lives. She also recently joined Doctors for America subcommittee on safe storage and hopes to improve physician counseling of patients and their families on safe storage practices. Thank you, Dr. Henry.
Thank you. All right, let me share my screen. I also have slides, so. Okay, so I'm hoping you can see my screen now. Yes? Okay. So thank you for the introduction. So I'm Kelly Henry. I am a MedPeds faculty member here at Loyola. And one of my things that I'm interested in is improving physician counseling on safe storage of firearms. And so I wanted to talk briefly about this important topic. Mostly I'm going to spend some time on the background of why I think this is such an important topic, since I don't have that much time to cover everything. But we're hoping to have some sort of training session later in the spring, so we can talk more about it at that time. And just real quick to bring COVID into the mix, like every other presentation, with COVID happening, we are seeing a surge in gun sales, and surveys are showing that the majority of people that are buying guns during this pandemic are buying them for personal protection. And those kind of guns are most often not stored securely. And so this is even more of an important topic in the timing of COVID. And the people that are buying guns have higher rates and incidences of anxiety and depression. So it's a different type of gun owner that are purchasing new guns at this time. So I think this is just all the more going to be a more important topic. And so just to go what Jenny had said, I'm also a member of the Be Smart campaign. So this is a program to bring together parents and all adults concerned for kids' safety and guns. I'm part of my lead in my local community chapter. So I've had the opportunity to give presentations to the local community groups and schools. And the Be Smart acronym stands for securing guns in the home and home of vehicles, modeling responsible behaviors, asking about unsecured guns in the homes that your children visit, recognizing the role of guns and suicide, and again, building awareness on this very important topic. So I also have some slides just for some background on why this is important. So in 2018, just to go like what Dr. Donaldson was saying, there's almost 40,000 firearm related deaths in the US. That's about 109 people every day dying from firearm related injury. And while mass shootings often make headlines, you see that that makes up a very small percentage of gun deaths in the US, with 2/3 of gun deaths are actually suicides and 1/3 are homicides. So specifically gun violence in children, car accidents are the leading cause of death in children, but actually firearms are the second leading cause of death in children in the United States. And they are the leading cause of death in children specifically in Illinois. They are also the leading cause of death in children, in Black children. In Illinois, Black children are 13 times as likely as their white peers to die of gun violence. Every year, 1,500 children are killed by guns. 800 are homicides, 600 are suicides, and 100 are unintentionally killed. So I also wanted to address the role of firearms in suicide. So suicide is the second leading cause of death, and this is from the CDC injury report, is the second leading cause of death from age 10 to age 35, and it becomes the third leading cause of death for young adults 35 to 55. So again, 24,000 people died by gun suicide in 2018. So guns play a major role in suicide pandemic in the United States, and 40 to 60% of child suicides involve a gun, and that's actually increasing as the years increase. How long do you think someone actually contemplates suicide? There was a study done that looked at adolescents and that attempted suicide, and they said they usually contemplated suicide about 5 to 10 minutes before they did it. So you can imagine when you have an easily accessible firearm, that increases your chance of a lethal form of suicide. Death by suicide is 5 times more likely in homes where firearms are present. So what do we know? We know that about a third of households in the United States contain at least one firearm. We know that there are 4.6 million children that live in a home with at least one loaded and unlocked gun. We know children under 13 that most gun homicides actually occur in their home. And we know that 90% of unintentional shooting deaths occur often in the victim's home. And we know that children as young as 2 years old have the tensile strength to pull a trigger of a handgun. So that is obviously very concerning. And then when it comes to school shootings, when it comes to incidents on school grounds, 78% of young shooters obtain the gun from their home or the home of a relative. So I just wanted to briefly talk, because it's always important to kind of give it some context about some consequences of what unsecured guns look like. And so these are some headlines from stories across the country. So at the top left, in January 2018, there was a school shooting at a Kentucky high school. 16 people were shot and 2 people were killed, Bailey Hope and Preston Cope. The 16-year-old shooter gained access to his stepfather's firearm, unsecured firearm in his bedroom. In the top right corner, this was a story from May 2018. There was a 4-year-old boy from Louisa, Virginia, who unintentionally shot and killed his 2-year-old brother, Tyson, after accessing an unsecured gun that was kept really high in an upper cabinet. The next headline, the bottom left, illustrates when kids carry guns out of fear, easy access facilitates the cycle of violence. And the bottom right, our final story is about a 13-year-old Mikey from New York. He was a popular 8th grader. He was an athlete. He liked to play video games. And one day he came home from school. He took his father's unlocked and loaded gun and he shot himself. His family knew him to be happy. They don't believe he intended to die that day. But unfortunately, with easy access to a gun, Mikey made a very impulsive decision that became a fatal one. And I also wanted to just touch base that this isn't just a pediatric concern. There's adults that we also need to be doing a better job of counseling. So I wanted to share one other story. This is a story about a woman named Dee. She was 75 and she accidentally was shot by her husband, Daryl, who was a former local police chief. He had been diagnosed 2 years earlier with a form of rapidly progressive dementia. He was unable to talk and he was unable to walk. He was in a wheelchair, but he was still able to discharge his handgun, unaware that he almost killed his wife at 57 years. She said he just didn't understand. She required 3 surgeries to survive her injuries. While all 5 of these stories are very different, they all show what happens when young people and those who are at high risk gain access to unsecured guns. And I believe they're all tragic and they're all preventable. So what is safe storage? So how many of you guys, when you were little or younger, you went and you searched for holiday presents or Christmas presents, birthday presents? Probably you found them. You know, guns are not any different. 13 million children live in a household with at least one gun. And studies show that the majority of these children know where the gun is located. And a third of the children have actually admitted to handling it without their parents' knowledge. So what does it mean when we say safe storage or secure storage? It means storing guns locked and unloaded with ammunition stored separately. Hiding a gun is not securing a gun, like the story we heard about the Virginia boy who shot and killed his 2-year-old brother. And we know that responsible storage is associated with a decreased risk of firearm suicide and unintentional firearm injury among children. So who should we be counseling? I just wanted to briefly mention, obviously children and adolescents should not have their hands on unsecured guns. Patients that are acute risk of violence to self and to others, so those with, this is an emergency, those with suicidal or homicidal ideations. People who have individual risk factors, so if you have a history of violence, if you have a history, you know, of drug and alcohol use. So alcohol use is common among firearm owners, and it's a well-established risk factor for interpersonal and self-directed firearm violence. And then firearm, you know, self-directed violence is also strongly linked to mental illness. So those with serious mental illnesses can have a suicide risk factor that's increased by 10%. And then dementia and cognitive impairment, those patients are, again, ones that should not have their ability to have access to an unsecured weapon. And then demographic groups that are increased risk. So these patients are also ones that we should be counseling. So young African American men are more likely to die from homicide than young white men, and middle-aged and older white men are much more commonly likely to die from suicide. So that's another age groups that we should also be counseling on safe storage practices and counseling further. And so, you know, we know that there's a large body of evidence that says safe storage leads to reduction in suicide and unintentional injuries. So why aren't we still talking about guns in the clinics? So I thought this was just interesting, and this is my last slide. I just want to point out the significance of this. So almost all pediatric residents that were surveyed stated we should be talking about gun safety with our patients, but 2/3 said that they never have counseled or they counsel less than 5% of their patients. When they did a survey of adult primary doctors, 2/3 of adult PCPs stated that they never asked about guns in the home. And there was a study that looked at veterans with suicidal thoughts, and they found that only 15% of providers documented firearm access. So this is a super important topic, and it's something that as physicians and healthcare workers, we should be talking about with our patients, and there's a variety of reasons why we're not. And I'm hoping that we can do a training later in the spring to kind of go over how we can counsel patients and do a better job of counseling patients. So thank you.
For that important presentation. I'd like to introduce Dr. Malik Henfield, our next presenter for today. Dr. Malik Henfield is a full professor and founding dean of the Institute for Racial Justice at Loyola University, Chicago. Dr. Henfield has published multiple scholarly manuscripts and books and delivered numerous national, regional, state, and local keynote addresses and professional presentations. His scholarship situates Black students' lived experience in a broader ecological milieu to critically explore how their personal, social, academic, and career success is impeded and enhanced by school, family, and community contexts. His work to date has focused heavily on the experiences of Black students formerly identified as gifted or high achieving, while his latest projects focus more exclusively on developing, implementing, and evaluating in and out of school interventions associated with developing Black students ready to succeed in college and careers. Dr. Henfield's research has resulted in millions of dollars of external funding, including most recently a National Science Foundation grant focused on increasing the number of students of color entering computer science professions, and an Institute of Education Sciences grant aimed at determining the extent to which school districts provide equity and excellence in their gifted education program. Welcome, Dr. Henfield.
First of all, thanks for inviting me to this. Can you see my screen? Okay, it looks like you see me instead of my screen, if I'm not mistaken.
We can see your screen.
Okay, good. Right, so thank you again for the invite. Unfortunately, I really do have to hurry. I've got a hard stop at 11, but I think I can push a little bit. So I think someone mentioned earlier that this is like speed dating. I echo those sentiments, but if anyone would like to learn more, please feel free to reach out to me directly. Jenny, if you wouldn't mind sharing my email address, I'd really appreciate that. So when you think about the Institute for Racial Justice, let's go back to June of 2020. after the murder of George Floyd, I sent the email to my faculty, staff, and students and said that we would become an anti-racist organization over time, and we're going to work really hard to get there. Our provost got wind of it, and he was, luckily for me, very supportive of the letter that I sent, and in fact told me to think bigger, because I was thinking about creating something within the School of Education. He suggested that we build something that's university-wide, including Rome, around this work. So I sent a brief two-pager, and he liked it and asked me to pitch it to the deans as well. They liked it, and over the course of the next few months, I was working very closely with the deans to flesh out what this could be. Over time, it became clear as we were meeting with individuals on and off campus that this initiative needed a leader, needed a person to be in place. So I went to the provost again and said, you know, we need to get this someone in the building and let them get to work. And he asked me if I would consider doing it. And I gave me the option to either do this or focus on the School of Education, where, of course, I was dean. I gave it some thought and decided to go in this direction. So starting January 1 of 21 this year, I've been in the role, so roughly 5 weeks now. And really just been going on a listening tour, just trying to figure out what the needs are in the community as well as at Loyola. And here's where we are thus far. And again, with the understanding, it's still a work in progress. So in terms of who we will be, we're looking at an initiative that will encompass everything that is Loyola. We're trying to focus on not just what's internal. In fact, I've been given a directive that a lot of our work needs to be focused on external as opposed to internal, because that is the work of the anti-racist initiative. But we want all of the best that Loyola has to offer in pursuit of racial justice and social equity. Here are our broad overarching aims. Research, education, and community engagement are the primary pillars. We want to build community and create capacity in the eradication of racism, anti-Blackness, and xenophobia. So how will we do this work in terms of the nuts and bolts of this? We're thinking about creating infrastructure, collaborative internal and external partnerships that are already in the works, and I'll get more into that in some detail later on in the presentation. And an intentional space for lifelong learners. We want people to look at Loyola as the place to go to learn more about the ways, the tangible ways, not just the abstract, but the tangible ways that we can move forward in racial justice work, in pursuit of social justice and equity. So anyone who knows me knows I'm a big proponent of thinking about KPIs and understanding exactly how will we know when we get there. These are very high level. Again, at the moment, we're thinking short term. We have to be understanding of who makes a good partner for us in the community and on campus for the work that we're trying to do, creating clear pathways and processes that people can understand when they want to collaborate and get involved in this work. That's the short term. Medium term, thinking 2 to 3 years from now. Strong sense of scholarly belonging. And I put scholarly belonging because it's primarily a research-driven institute. We will do community engagement and we will do education, of course, but it's mostly driven by the research that will be conducted by faculty, staff, and students at Loyola, and as well as partners in the community and other places around the United States. Lots of traditional offerings, but also free offerings for the public through our website that's currently being created. And then ultimately, we want to, again, establish a strong national reputation for this work. So here's some high-level ideas of the sorts of things that we'll be researching. And when I think about the levers, what I'm talking about are the ways that we will actually go about doing all of the things that we're best to do moving forward. So research, practice, policy partnerships. So we have an example of one that I'll share in the fall that's currently in development. It's very exciting. I think that a lot of folks are interested and understand research practice partnerships, but there's also this policy component that from what I'm hearing and talking to community members is something that they want as well. In residence experts, so I want community members who are experts in these areas that we're researching to come and be in community with us to further drive the work. And innovation seed funding, right? In order to get some of these projects off the ground, we will require resources, and I'm in a position to supply some of that. Faculty fellows, so we need folks who have their time bought out, who can focus on this work. Joint faculty appointment starting in fall 22, I believe I will begin hiring for faculty who will have a joint appointment in the Institute as well as other schools on campus. We'll have scholars and residents from other universities who will come for a semester or for a year or even shorter periods, and just to be in community with us and again, help us drive this work forward. And research circles. One of the things that I found a lot of pleasure in just being in community with you all today, just learning about the good work that's already being done. We are operating in silos at Loyola, and part of my mission is thinking about ways to break down those barriers, break down the silence in between units that are doing great work, and get us to be together and on the same page and understanding how we can build off of one another's work. And I think that I can do that, that we can do that through research circles. It's just a matter of developing the mechanisms that will allow us to do that. In terms of student engagement, we'll have graduate fellows, undergraduate fellows, but also postdocs and pre-docs. We want to, again, develop and nurture the future leaders in terms of research on racial justice and social equity. Here are just a few examples of some of the areas that I'm hoping that we'll be able to come together and work on as a community. So much of what I've heard thus far today, I'm getting excited as I listen, because honestly, I didn't know that a lot of this work is being done. Quite frankly, we have some calls with the Criminal Justice Center and myself scheduled for later on in this month and next month to try to figure out what partnership could look like. And I'm imagining that that can be extended to some of the other presenters from today. It's pretty exciting work. For those of you who may not know me, my background is in education, particularly school counseling. So there's a lot of work that I'm currently doing that I'll share in a little bit more detail as I get further along. But here are some of the ideas that we've thought about in terms of research as we move forward in this area. Holistic health and healing. The second one, for example, there are a lot of chief diversity officers who are being named all over the country, and many of them don't have necessarily the experience or know how to do the job effectively. But I do think that if we come together with some of the research expertise that we have on this campus, along with those people who are in these positions as chief diversity officers, that we may be able to develop sort of trainings and workshops and even tangible curriculum through the business school and other partners on campus that can support these individuals and those who want to ascend into those positions. Social mobility, so I'm having a lot of calls right now, and artificial intelligence is the topic of the day. It's not going away despite what people may want. So it matters, a matter of how can we develop artificial intelligence that takes into consideration the factors that are unique to Black and Brown folks who've been victimized. And I'm speaking specifically to a story that you heard about some of the larger technological companies of the day, without naming names. Transformative futures. This is where I'll be relying on faculty who have expertise in the arts and sciences to help us dream, to help us hope. How can we think about a reality that does not exist? What does that look like? How can we take those dreams and then transform them into tangible steps that we can operationalize at present? Environmental justice and sustainability. We're in conversation right now to think about what it will look like to create a track that incorporates a lot of the anti-racist environmental justice work that's being done in Chicago as part of a core curriculum, leveraging the assets that the School for Environmental Justice has. So and again, thinking about some of the courses that we'll have, because it's a university-wide initiative, we'll be able to tap into the talents of every school that we have on this campus, including Here are some thoughts about initial educational offerings, standalone courses, minors, concentrations. The one consistent, well, there are many consistent findings from my interviews with community partners, but one of them is community convenings. I've been told repeatedly that so many entities in Chicago offer a presentation on a topic and then it changes from month to month. Folks want things that are deep and rich and really getting to the core issues, the nuts and bolts of what they're experiencing, without jumping around from topic to topic. And I'm hoping that the Institute for Racial Justice will be able to supply that. So again, going along with this idea of research practice policy partnerships, there are some individuals who really want to work with us and are willing to share data in a symbiotic relationship with folks here at Loyola. And in turn, they want us to help them advocate for issues that are mutually beneficial for all parties involved, particularly as pertains to the experiences of Black and brown folks in Chicago. Here's a statement from the Director of Research and Policy at the Chicago Urban League. They've signed on to be an official partner and working very closely with us to figure out exactly what that could mean. How might we be meeting a need? How might we avoid replicating what's already out there? We want to be an add-in, not an add-on. So in terms of next steps, as of right now, I'm an Institute of One. So these are projects that I'm primarily heading on my own, but over the months to come, I'll be hiring and doing some other work to get some other involvement. So I tried to give an example of the 3 different pillars that are already in place based on my work from before I took on this role. The most recent is this top one, citywide task force on innovation and learning loss. We're doing interviews with and focus groups with folks from all over the city with the idea that by the end of March, we'll develop a white paper of recommendations that could be presented to the mayor's office. And we'll also be working very closely with funders throughout the city who may be able to fund some of the ideas that we come up with. I'm very much into transformative experiences for folks at Loyola. So there's one staff member who's out of the Walmart Center specifically, and 2 students out of the School of Ed who are partnering in this work. I've also been approached by a group of primarily Black and brown superintendents in surrounding areas of Chicago, and surrounding areas, representing 400,000 students and 25,000 educators who want to partner with us and build with us. And we're really thinking deeply about what it would mean to create a research practice policy partnership. They came to me for support with developing DEI professional development for their superintendents in the consortium. But now we're thinking about bigger and bolder ideas around what this could be. I came to Loyola from the University of San Francisco, and during my time there, I had a contract with the mayor's office around this sort of work. Those ties are still there, so we're in conversation to try to figure out exactly what that could look like. One of the things that they've asked me for is to create a community engaged research institute. There are lots of community stakeholders who want to understand research and program evaluation and the like, and I've been charged with developing curriculum that's free for community members in such a way that they can easily understand it and have it not, again, be an add-in, not an add-on to the work that they already have on their plate. Already developing study the US courses. I'm thinking about what it would look like to compare and contrast the experiences of individuals in Chicago with those in Oakland and in San Francisco, the Bay Area. Lots of connections there from my time spent there, and I'm slowly gaining those similar connections here in Chicago as well. I've always been focused on developing a study abroad course here at Loyola that's already in the works. In fact, we were expected to go this summer, but because of COVID, that got put to the wayside. But it's in the works for summer 22 now. In terms of research, I've got 2 grants, one IES grant that's focused on the state of North Carolina. The first 2, we were in year 2 of a 4-year grant. Starting this fall, I'll be going down to North Carolina with a team of folks doing interviews and observations in school districts all over the state, trying to figure out how they are determining equity and excellence in their gifted education policies and how they play out on the ground, with the idea being to change how things are done in the different districts throughout the state. I'm collaborating on this with 1 faculty member in the School of Ed and 2 doc students. I also have a National Science Foundation and NSF grant partnering with this computer science program at University of San Francisco. And I think the big idea there is trying to figure out how students can leverage their talents that they're learning in their program in support of community members who are coming to the program with specific tasks that they could use support on, to leverage their work. So in closing, moving forward, it's just a long strategic planning process. Last fall, we did focus groups with a few faculty of color on campus to try to figure out what their research areas are, what would they like to see in terms of teaching, what sort of supports are needed. As we move forward this semester, I'm working very closely with individuals on campus to do focus groups and surveys with others, try to figure out, again, what these needs are. We want to fill needs. And then we have to figure out those partners and what are the factors that we're looking for that will determine what makes a good, strong partner. Then, of course, I'll have to do some hiring. I'm already searching for an assistant right now. That search is out there right now. But the next positions will be directors of research, directors of curriculum, and others. And right now, we're also hosting, co-hosting convenings. We're sponsoring something with Curl right now, and there's a few others that are in the works. By summer, June specifically, I have to do a presentation of the strategic plan to the Board of Trustees. They've already told me that they like what they're hearing thus far, but they want more details, and that's what I'm working on to provide them by that time, by June. And then once I get the final okay from them in June, we'll move forward with establishing an advisory board. With the official launch happening fall 21, where we'll start recruiting faculty and student fellows. And again, we'll put out calls for joint faculty starting academic year 23, which would be fall 22. Racial justice research circles, again, breaking down the silos and trying to figure out what people are doing and how can we get together and build on one another's work, collaborate with one another more effectively. And finally, this fall, I'm expecting to come out with announcements of formal research practice policy partnerships in Chicago and surrounding areas. Thank you so much for your time, and I'm so sorry that I have to leave so abruptly, but again, if you have any questions or would like to know more information about anything that I presented today, please do not hesitate to reach out. I would love to communicate with you, and share some thoughts, and dream and build together. Thank you.
Thank you, Dr. Henfield. We'll share your email with folks here. It's, I think, already in the chat, and we'll look forward to what comes next in partnership and as you lead the way into this exciting new adventure and long overdue process in many ways for us as a university. So thank you.
Thank you.
Sorry to keep you from your next engagement.
You have a good one.
You too. Thank you. There's so much to share. It's not at all surprising that we're running a little bit long. We knew that that would be a risk, but also hopefully a benefit here as we continue to share this information. So up next, last but not least, we have Seth Green. Seth is the founding director of the Baumhart Center, an interdisciplinary center at Loyola that prepares leaders to tackle society's most pressing challenges through education, engagement, and research. Seth is also an executive lecturer in Loyola's management department, where he teaches courses on nonprofit leadership, social entrepreneurship, and corporate social responsibility. We had the benefit of working with Seth on the Maywood Social Enterprise proposal, and which was just awarded funding through the Illinois Criminal Justice Information Authority R3 grant that Dr. Olson mentioned earlier. So really, truly, it does take a group of collaborators to make a lot of these things move forward. So thank you all thank you, Seth and Dr. Olson and everyone who collaborated on that. And I will turn it over to you, Seth.
Great. Thank you so much, Ginny. And let me share my screen here. And I will try to catch us up a little bit. So I will run through hopefully a lot of information, but quickly, because my goal is to just give you all a snapshot of what's happening in the business world to try to stop gun violence. And just to give a little bit of background for those of you who may be outside of this, specific area of focus within the university, there has been a real change in business that is behind the move that we're seeing specifically by businesses to start taking meaningful action on gun violence. And it's what we're calling the rise of purpose in business. So 3 in 4 business executives now say that social impact is important or very important to their company strategy. And I just wanted to give a little bit of background on this trend, and then I'll jump in specifically to how businesses are taking action and how we're looking at that and helping to accelerate it at the Quinlan School of Business. So you've probably seen some of this, but business, and this is just kind of proof points of their greater involvement in purpose. There is more philanthropy going into the world than ever before, $15 billion last year. Many of those commitments on issues like racial equity and on the pandemic. We're seeing businesses step up through what's often called shared value creation. They're figuring out with their product lines, how do they do more for the world? So Unilever has helped 1 billion people improve their hand washing habits with particular impact during this COVID moment. That is in addition to what they may be doing on the philanthropic side. And then we see companies like McDonald's figuring out how to drive sustainability into their supply chain. And then the final trend, which is really a new trend just in the last couple of years, is that more companies than ever are taking a stand on issues. So after we withdrew as a country, thankfully we're back in now as a government, but for a while we were out of the Paris Accord. All of these companies came out and said, we're staying in. And on the DACA decision, for example, again, our country's headed, in my mind, in the right direction again on a lot of these issues. But when we were not there, a lot of companies were stepping up to answer through a call to action. And the rationale behind this growing movement is that when companies are thinking about their world, they are feeling pressure from employees to take action, from customers, from suppliers, and from their investors. And just to give you a little bit of this data, millennials now say working in a workplace that aligns with their values is extremely important. 7 in 10 say that it's a major consideration when they're deciding where to join a company. 76% of all employees now say that their CEO should take the lead on change rather than waiting for government to impose it. So employees are a big factor in motivating companies to think about what role they can play on major social issues. Customers are playing a big role, nearly 9 in 10 saying that they will actually make what are called brand democracy decisions, where they're deciding what products to buy based on the potential impacts. And then investors. So nearly $41 trillion, or about a third of assets under management in the US are now under an ESG framework, with many now even filtering out specific products like guns, so that that makes it harder for the manufacturers to get access to capital. So I share all that to say that there's been this movement. This movement has accelerated in the last year because of both the unprecedented times and the 401 pandemic as a country that we are finally reckoning with in these last 9 months related to our history of white supremacy. And employees are bringing that urgency to work. So the Edelman study looks every year at the sense of urgency. People are far more urgent in the way that they're approaching their employers on these issues. And you can just see here that people feel that their employers should be doing a lot more on issues related to climate change and poverty and discrimination and racism. Okay, so that is kind of whirlwind, big picture, changing business world. There is actually a rationale that businesses feel that they should be doing more than just their pure bottom line. They should be thinking about what is their citizenship in the world and how do they think in terms of what their employees, their customers, their communities, their investors may be expecting. And in the context of that, we have had a number of significant decisions by business related to gun violence that are helping. And I think the question that we'll ask at the end is obviously, how can we do more to prompt business to take even further action as one of the levers here that can help our country to become safer? So you've probably seen this, but Dick's, after the Parkland shooting, my mom was a longtime educator actually at Douglas High School. So that shooting rang particularly close to our hearts. And after that shooting, they decided that they were going to permanently remove sale at all locations. And so they've made significant changes that have reduced the availability to buy guns. Walmart made a similar decision soon after. Obviously, there's a very clear question of why business waited until that moment. The amount of people killed by gun violence in a couple weeks in Chicago matches what happened in the Parkland shooting. So I think there are very rightful questions about why it took so long and why it took a largely white school. But the matter at hand is that they were finally in a position where they were moving on these issues and taking it seriously. And that has dramatically changed the availability. If you look at someone in any particular place in America, their ability to access some of these weapons now within 10 miles is dramatically lower because of Walmart and Dick's decisions. And so that has an effect, especially on some of these impulse-based crimes that have believed to be, even though crime has gone up for other reasons, that have believed to be very helpful in reducing gun violence. So one piece is to stop selling. There are many people that are still out there, but what we have seen in the business world in other cases is that these first mover effects matter. So CVS decides they're not going to sell tobacco anymore because they're a health company, and they say, well, for a health company, it's probably not the product that we should be providing, even if it has sales associated. They actually took a significant hit in the short term, but they had a major reputational gain in the long term because their greatest relationships are with other healthcare companies. And now Walgreens is testing that idea in a number of places, and I believe may end up making the same decision, and some of the others may follow. So it takes some time for these knock-on effects, but the belief is that Walmart and Dick's are actually going to have a significant impact on the market as a whole. Another example is pressuring change. And here we're getting into some of the companies that might be considered a little edgier, but that are really aiming to align their assets as a brand and as an identity with the efforts to reduce gun violence. So one example is Tom's has been very active on this topic, giving over $5 million, but also using their platform as a way to really inform Americans about this issue and to help take action. Another example, in addition to Tom's, is Levi Strauss. And I encourage all of you, if you're thinking about kind of how to make some of your consumer decisions, to consider that as a potential issue. You can go to progressiveshopper.com and you can actually see when you're making a decision what the views of the companies are on this and other issues. And in many ways, they are paying a quote unquote price for these decisions. So I just pulled this as an example. The NRA has put this out as a way to inform their members. I will acknowledge I personally find this to be an endorsement. So I kind of see what they put out not to do as almost my own invitation to do because of my own values around believing that we should be more thoughtful as a society about how we approach guns and how we make sure that we keep people safe. And then the final area that is interesting in terms of putting pressure, this is Larry Fink. He's the CEO of BlackRock, the largest asset owner in the world. And they have a lot of pension funds, and they have finally been moving their money more and more toward purpose, as a lot of those pension funds, CalPERS, for example, which is one of the largest pension funds, have said, we really want to make sure that when we're investing, that our values are being applied. And so they have, in an unusual step, really put out a very specific set of expectations for the gun manufacturers that they're invested in. One can ask very appropriately why they're still invested at all. And that's certainly something that CalPERS and others have been asking, and one we want to put more pressure on. But in this particular letter, what they put out was a request that there be a lot of data collection on, have these guns that they have been manufacturing been used in any crimes? If so, where? And so there's a level of accountability that is slowly coming into finance that will be very helpful, because as that accountability grows, it will hopefully force what our government regulation hasn't been able to force, which is a much higher level of accountability in these gun sales, which is part of the issue. Because if you can get out of some of these sales that are not legitimate or not being monitored very closely, you're much more likely to have the safety implications. Okay, the final thing I just want to say out loud, because I feel like I wouldn't be doing my job as a faculty member if I didn't, is that obviously business has a much larger role to play in the broader issues at stake. There is a tremendous amount of research that inequity as a broad form of oppression has a significant role in violence, and included in that is gun violence. And so, right now, while I have given business credit for being better on these issues in the past, business, in my mind, still stands in the way of much needed reform that would be very important to reducing violence in our world. And, just an example that's very current, business groups have been lobbying against the $15 minimum wage. Just to give you a sense of my own views on these topics. This is what has happened since the last time the federal government made a real progress on the minimum wage. We've lived in a world where there has been significant productivity gain, and hourly compensation for our lower income workers has not gone up at all. And all of those gains, as you can see there, are going to owners. The result in our world is that we are living over the last 40 years in a period of dramatically growing inequity. And you see on this graph kind of what's happened over time. And what has also happened is that we've actually gone backward on issues like racial wealth. And if you look here in 1980s, when Reagan was president, we had an 8-to-1 gap between white and black families. Obviously, that was entirely unacceptable, but amazingly, that was actually better than the 10-to-1 gap we face today. And so if we think about business, there is the role in directly working on issues of gun violence. In my view, there's also a systemic role that business should be pushing for minimum wage to be higher. They should be thinking about workers as stakeholders, and they should be taking an all stakeholder approach. And I think that systemically, those approaches, even if there are guns in the world, which I feel we should be dramatically reducing, would have a very serious consequence on the issues we're talking about by having a much higher level of equity and many more positive consequences on a systemic level. And so with that, Ginny, let me turn it back over to you and just say that for those who are interested in these topics, we would love to have you join us at this moment virtually for opportunities at the Baumhart Center to learn more and to be a change agent using business tools.
Thank you, Seth. That was wonderful. Really appreciate the framing. We are going to go right into a quick conversation, and I'll turn over to Dr. Hatchett to lead us back into the conversation about bold vision and 150-day goals.
All right, thanks everyone, to all our speakers. Now it's our time to do the work and digest what we've heard. We've heard from the experience of people with lived experience of inequity, community, business, public health, healthcare, criminal justice, education, and more. And what I'm asking you to do, what this session is about, is to create a bold vision for us as a university in partnership with our community. What could we achieve together that we're unable to do on our own? And we're going to use the cloud system that Jenny has so graciously prepared. It's called Minty. You will log in to www.minty.com and use the code 4959992. And your words, keep it to 1 to 2 words, will pop up, and we will do the work of looking at the synergy and the stories behind your bold vision. So we're going to turn and process everything we've heard from those mini presentations to look at your bold vision that we can achieve between Loyola and community. And we can do this in silence. We'll have 2 minutes. Just put your 1 to 2 words into the system. You're also, if you don't want to log into minty.com, you can send Anna a private message, and you can find her in the chat. And just share your ideas without overthinking. That vision is about what would you want to see if we had all the resources, all of the opportunities, and all of the time needed to transform our system. There's 30 seconds more on our bold vision. As those words come in with the bold vision. In my presentation, I talked about dreaming big, but acting on the small scale. And we are going to then think about if our goal reach vision is out there, what would be the 150-day goal that we would want to see as a pathway towards that bold vision? In 150 days, what would be a meaningful, impactful as a first step towards that powerful, bold vision? Again, you'll have 2 minutes to write into the chat or to Anna or use menti.com. What's a realistic goal towards that bold vision? Something we could achieve as an institution with our community in 150 days. Folks are saying convene work groups, Loyola class on gun violence, cross-department dialogue, after-school tutors, communicating with leaders, bank loans for business, nonviolent communication. Convening work groups. Respect. Respectful community meetings. Right. Just like the popcorn and the popcorn maker, the hits are slowing. Jenny, well, this will stay open for a little while longer. So Minty will stay open, and you can also write comments to Anna in the chat. And I'm going to turn it over to Jenny for our evaluation and summary. But these ideas, this bold vision and these 100-day goals will actually create a realistic pattern for us to go forward. There was synergy in our mini talks. Us as presenters didn't get to talk before today, but there was a synergy of ideas on what's possible, from Kim Foxx right down to Seth Green. So Ginny and her team will take this bold vision ideas and these 150-day goals to create an action plan for us to go forward. Ginny, back over to you.
Thank you, Dr. Hatchett. Thank you to all of our presenters today. I know a few folks had to step off the call. Still kind of lamenting that we're not together in person. This is one of those conversations that you really want to kind of cluster afterwards and talk with one another about what came up in the word clouds and what was mentioned today. So the hope is that we do actually have our monthly Loyola Stands Against Gun Violence meeting this Thursday at 11. If you're ever interested in joining that meeting, don't hesitate to reach out. We're going to post a lot of these slides and the recording and the word clouds on the Loyola Stands website as we move forward and the speakers are comfortable. Finally, evals. If you are hoping to receive credit, CME credit for attending today, you have to complete the evaluation, which is separate than the evaluation for the summit. So we will drop both of those links into the chat right now. Thanks, Anna, for doing that. And we will look forward to hearing what you have to say about this. We also hope that we continue these conversations, this cross-department dialogue that's so big on the word cloud in front of us. There's some real opportunities here to collaborate cross-department and university community. And Dr. Hatchet is our university community partnership director, and so understanding what it looks like to be in conversation, to be working together across departments and disciplines as we move forward. So stay tuned. We'll send an update out by email, especially to check in with you at 150 days to see how things are going. So once again, thank you for being here today. You're welcome to enter more things into the Mentimeter word cloud as you think about them further. We'll stay on for a minute for questions or comments as we go further into the day. Thanks so much for a great time together. We really appreciate this important conversation and the opportunities to carry forward in shared work. Thank you again.
Thanks, everybody. Thanks, Ginny.